So hi, everyone. I'm Dr. Eugenia Gianos. I direct cardiovascular prevention and women's heart disease at Northwell Health Hospital. Two really, really important topics. I know that you guys have already gotten lectures in other topics in cardiology, but the reality is that these topics are way better than all of the other ones that you've heard of so far and that you're going to hear of in the future. And I'm hopefully going to convince you as to why these areas, cardiovascular prevention and women's heart disease, are really the most exciting of all the fields in cardiology. All right, so I will start, and I'm going to talk about a patient because, you know, preparing you for your future careers in cardiology. So you've got a patient in front of you. He's Mr. Smith. He's 54. He comes into the emergency room and he had chest pain, and he's found to have a heart attack on his EKG. And they take him into the cath lab. They fix his artery, but unfortunately, he is still left with poor pumping function of his heart because he's had damage from this heart attack and a poor prognosis overall. So when we look back at Mr. Smith and try to figure out what may have put him at risk for heart disease, the question is, do you think his age put him at risk, or his cholesterol, his blood pressure, being obese, or potentially all of these factors? And in fact, each of these different factors can put somebody at risk for a heart attack. And if you think about the people we meet, when we meet them in the hospital coming in for their heart attack, some of the typical things we see are abnormal cholesterol, high blood pressure, diabetes or pre-diabetes, or obesity. And the interesting thing with this patient is that the sad thing is he had come in 5 years before, and they told him, you know what, you have no major blockages, don't worry about it, you're fine, and came back exactly with the same risk factors that we knew about 5 years ago, but we did nothing about them. So we can entirely prevent this process if we actually get on top of it. Unfortunately, in the world of cardiology, you heard a lot about, you know, more invasive things, and you'll hear about defibrillators and devices that help people when they already have end-stage disease. But the reality is that we could prevent the majority of this, which makes way more sense if we just turn off the faucet instead of mopping up the floor. So when we talk about heart disease and blockages in arteries and everything, this is what that process looks like. It's this mushy stuff that accumulates in the wall of the artery. It's from cholesterol, essentially, and it just deposits there for various reasons. And the issue is that what happens is one tiny little amount of this plaque can break off, and all of these little platelets, which help with clotting, go and stick there. And that's actually what causes either a heart attack or a stroke. And essentially, it is not discriminate. It's the #1 killer for both men and for women. And cardiovascular prevention, when it comes to women, is actually almost a field in and of itself. There's so many important ideas to think about, you know, when it comes to women that are different in terms of, you know, whether or not they may elect to have children at some point in their life, and menopause and other things. So, you know, in my mind, you know, we really miss the boat when it comes to taking care of women, unfortunately. If you think about it, and fortunately, some of this stuff is starting to change. I certainly played basketball a lot of my high school years and some of college. So, but typically, young girls are not always as active as boys, and sometimes not even encouraged to be as active as boys. You know, sometimes eating disorders can be more common in women. And often people just postpone heart disease prevention until women are in menopause. And women are basically at high risk and just not treated for all of their childbearing years. So this is basically what a normal artery looks like, one with some plaque and one that has basically got a blockage because of clot. And patients often tell us, oh, you know, I was totally fine until I had my heart attack that day. The reality is that people are really not fine until they have the heart attack. They just don't know about what's going on in all of their different arteries. And they're silent until essentially something bad happens. So when you think about this process, it's called atherosclerosis, and that's a pretty fancy word just to essentially indicate the plaque that accumulates in the arteries. Which arteries do you think are involved? The heart arteries, the leg or arms, the neck arteries? Well, essentially, it is, again, all of the above. And this is a process that happens everywhere. If you come in for a procedure because you had a blockage in your heart, you have to know that probably there is some of this plaque in all of the different arteries in your body. And the risk factors that put you at risk for heart disease, some of them are well established for a long time. We've known about the fact that, if you have a family history, if somebody in your family had heart disease at a young age, you really need to know whether you're also at risk. Other factors, high blood pressure, high cholesterol, diabetes, obesity, are all known risk factors. And now we're learning about some really interesting, innovative other things. Emotional stress can actually be a huge risk factor for heart disease. Inflammation, even if it's from some other process that's going on in the body, that can put you at risk for heart disease. Early menopause, complications of pregnancy can all actually put you at risk. Now, the most important thing is that you can prevent this process, and the way you would do it is essentially by getting all these different risk factors under control. If you have any evidence of diabetes, blood pressure, high blood pressure, cholesterol, smoking, etc., if you can get each of these in the optimal region, then the chances of you coming back with a heart attack is extremely low. Unfortunately, most of the patients we meet are very much in the poorly controlled area for these, and that's really what's leaving them at risk. So the field of cardiovascular prevention, which is very much an emerging field, it's got so many different aspects to it. So number one, it's individualized risk assessment. So you look at each person and figure out what their specific individual risk is. We now have amazing genetic testing, so we can sometimes discover whether or not somebody has a predisposition to have heart disease. We have advanced lipid testing, which is essentially advanced cholesterol testing. We've got great meds for diabetes, high blood pressure, lifestyle and behavioral therapy. This is often an area that is just not optimized enough. And really, we need to do this on a population health level. And I'm going to recruit all of you to actually get a lot of what we're talking about out there. So there's another concept, something called primary versus secondary prevention. So secondary prevention is essentially prevention in somebody who has already had disease, a heart attack, a stroke, or potentially just blockages in different arteries, and they already know they have disease. And then primary prevention is really in patients who don't yet know to have any disease. And we do have different things that we do for each of these individuals. So anybody who already has heart disease, has plaque that we're aware of, then they really should be on a cholesterol lowering medication and something that blocks their platelets like aspirin or other agents. So those are absolutely essential in somebody who already has heart disease, because they're going to reduce your risk of having a heart attack and stroke in the future and keep you alive, really. And then for people who are not yet diagnosed to have heart disease. So, figuring out what somebody's risk is when they haven't yet had an event is far more complicated. And as you can see, one size fits all doesn't really relate in this category. One person could have a very strong family history of heart disease and have, diabetes, and the other person can have no family history of heart disease and no other risk factors. So we really have to tailor it depending on what an individual's risk is. Now, lifestyle medicine is another forgotten field of medicine. In our medical world, unfortunately, people are very quick to put patients on medications and give them procedures and do other things without actually addressing one of the most important parts of health, which is your lifestyle. And lifestyle medicine really is like an individual therapy. So one question we get a lot of is whether or not, if you have, let's just say you have a genetic history of early heart disease. And so, you know, your uncle and your dad and your grandma all had heart disease. Does that mean you're destined to have heart disease? And how much does lifestyle really contribute? Can you improve that risk? Does it even make a difference once you have a genetic history? Well, it turns out if you have a high genetic risk, then yes, in fact, it does make a difference with respect to lifestyle. You can be born with a very high risk, and you can have that risk if you have a healthy lifestyle. But the opposite extreme is something that we see also very often, is that people are born with very little genetic risk, and yet because they have a poor lifestyle, they can double that risk for heart disease in the future. And it's really quite sad, honestly. We see patients now, we have a study that we're enrolling in that's called Young Heart, and it's designed specifically for patients who are under 55 years old who are coming in with heart disease. And, you know, heart disease is customarily a disease that happens later in life. And the fact that we're seeing this so early in life really means that we're doing something very wrong when it comes to lifestyle. And here's the typical American lifestyle, but, you know, we've got room for improvement. We can definitely work on that. Maybe during this COVID time, which has been a little challenging for all of us, we may have reverted back a little bit to here, but we can definitely get, you know, make some changes. And when we think about mortality, which is death rates and stuff, and why people around the world, and this is a global study, why people are dying, it turns out that diet is the leading factor involved in heart disease. So, you know, the top 5 things that contribute to heart disease in the world are diets that are high in sodium, low in whole grains, fruits, nuts and seeds, and vegetables. And this is something that holds true across different sociodemographic indices, which means this is something that pertains to the rich, to the poor, whether you have an education or not. This is relevant to pretty much everybody, and we have a lot of area to improve here. And also, physical inactivity is responsible for a lot of the burden of disease. We have become, over time, as you know, we've progressed in many ways in the world. We've also taken steps backwards in terms of activity, and it contributes to so many different diseases: diabetes, breast cancer, colon cancer, heart disease. You know, very important to keep in mind how important activity is. And the last one, which I think, you know, has been brought out to some extent during this time of this pandemic, that, you know, psychosocial stress is really important in terms of disease overall. And it is an area that we can actually impact. And so when it comes to heart disease, in fact, patients who've had heart attacks have been found to have significantly more stress, all forms of different stress, actually. And patients, with heart disease also have been found to be associated with different symptoms like loss of interest, financial stress, various factors that are contributing. So when we want to fix your lifestyle, you know, let's say you get motivated and you say, you know what, I'm actually going to make lots of changes. I'm going to do things that are healthy, and I'm going to get out there. Well, you know, when you turn to books and the media and see what's on the internet to guide you, it's quite confusing, right? You know, there's all kinds of advice out there, and how much of it is actually, you know, seen, and most of it is contradicting other things that are out there. And when it comes to diet specifically, I have to say it's quite controversial. So this is a great cartoon because it says that our menu is divided into 3 sections: cancer-causing foods, artery-clogging foods, and foods that are being boycotted for political or environmental reasons. And this is the reality. I mean, I'm sure even in the high school, you know, community, you probably have friends who are doing one type of diet or another type of diet and feel absolutely strongly that, you know, their diet is the best diet that needs to be followed. So, you know, this is definitely an important topic, and I want you to have the facts, and then you can decide what you want to do at the end of the day, but at least start with knowing, you know, what's the reality about diet. So which of these diets is not recommended in the latest guidelines as being a heart healthy diet. So, there's the vegetarian or vegan diet, which is predominantly plant-based. The DASH diet is a diet that is mostly plant-based also, but also with lean poultry and low-fat dairy and other things included. The Atkins diet, which is essentially a very low carbohydrate diet, and the Mediterranean diet, again with plant-based foods, but also with smaller amounts of meats and dairy and a lot of olive oil and nuts. Well, it turns out that of all these diets, the one that is definitely not heart healthy, it's the Atkins diet. And the reason being is that the Atkins diet essentially is one that can include very large amounts of animal products, and specifically foods that are high in fat but saturated fat. There are good and bad fats, but the Atkins diet unfortunately does not gear you towards a high plant-based component, and it really can be detrimental because of what is in the diet. So in terms of what we know about diet, it's a little bit complicated to figure things out in diet. You can't, when you do research studies, you put one person on a given pill and then you put someone on another pill and you follow them for 10 years. Well, when it comes to diet, you can't really have a group eat red meat every single day for 10 years and the other group not. This is really challenging to do dietary studies to begin with, but we do have some studies and a lot of information from, in some cases what we do is we have people fill out questionnaires and learn a little bit more about their diet and their habits and their patterns, and then follow them over time. We have animal studies and research in models where we feed, let's say, an animal a given diet, and we see over time what the effects of those diets are. And then we do have some studies where we do actually randomize a patient to a diet type, and we try to help them to stay on that diet and see the outcomes over time. So really, we do have a decent amount of evidence from a lot of this different data to explain to us what is healthy. So if anyone ever tells you, there's not really good evidence out there about diet and we don't really know that things are healthy and therefore I'm going to continue to have cheeseburgers and fries every day, they're just trying to convince you that they should just eat what they want, but not that there is not actually data out there. There's definitely enough data out there. So, you'll continue to learn about research and studies, and for the most part, when you look at studies, they follow people over time. So as you see here, it's how many years after they were enrolled in a study are they followed out. And in this particular study called the Leon Heart Study, they took people who had had a heart attack, and they had one group have a Mediterranean diet and the other group had a control diet. So over here you see the percent without an event. And an event is a bad event, to be clear. It's a stroke, a heart attack, a cardiac death, things like that. So you can see that the group that did the Mediterranean diet were far more likely to have go for 5 years without having an event compared to the control group. And this is really impressive. Sometimes we put people on medicines, we do procedures, things like that. And even with those, we're not able to achieve these kinds of impressive results. So the fact that you can eat a specific diet and change your health so significantly is actually really impressive. So the difference is, just so we know like what we're talking about in terms of absolute numbers, between those groups, there was 16 versus 3 cardiac deaths, 17 versus 5 heart attacks, which is essentially the myocardial infarctions. And overall mortality, 20 people died in the group on the control group versus 8. So that's pretty impressive in my mind. And the interesting thing is that even though they saw these results, even though people's cholesterol numbers were pretty similar, their blood pressures were similar in the groups, and their weight loss was similar. So it makes you think that there's something in these foods or the diet that is leading to health. Maybe some antioxidants, some vitamins, some omega-3 fatty acids, but something really important that is conveying health. So this is another study. Again, this is a PREDIMED study in Spain, where they took thousands of patients who didn't have heart disease yet, but they had some risk factors for heart disease. And again, had them do a Mediterranean diet. The cool thing is that they either got nuts delivered to their home weekly or olive oil free as part of the study if they were in the Mediterranean group. And you can see that the ones that got this over 5 years, again, did much, much better in the long term. And another thing you'll see, as you learn more in science in general and in medicine, is that when you look at studies, you say, okay, how come they did so well? What is it that led to this great outcome in the study? You want to really break it down and make sure that you understand where the benefit is coming from. So it turns out here, and you are starting from 1, let's just say, and the lower you get this number is the lower you've reduced the risk. So essentially, the lowest risk essentially was from stroke. That's how these people did very, very well in the long term. They were able to reduce their risk of stroke to improve their health. They also reduced these others, heart attack and death, etc. But the biggest benefit is from stroke, which I would argue is actually a huge benefit. And another interesting thing is that as you look at the people who ate the most vegetarian foods over the years, the more vegetarian food you ate, the better you did in the long term, and your death rate was the lowest in the more vegetarian food. So we can really use that to draw conclusions about what is good. So I happen to be of Greek background, and I grew up eating predominantly this type of food, which is what you would call a traditional Greek diet. And then, certainly you can go to a Greek diner and eat very, very healthy food and even have stuff like this, but got to be careful not to be thinking that this is a Greek diet. Maybe you could get it in a Greek diner, but this is essentially a meal that probably has very little benefit, right? So this, meat does not look very fresh to me. I've got bacon, which is filled with saturated fat, some deep fried onion, and even these, the tomato and the lettuce, in terms of how much nutrients is left in this actual meal and the deep fried fries. I mean, really you have to be thinking about, and again, not that you can't intermittently have foods that taste good and you are eating something as a treat, but just don't fool yourself into thinking that you're eating healthy. So I'm going to ask each of you to think about this in your head, and you can just, you can write it down if you want, you can just know in your head what you think, but how would you rate your overall diet? Do you think it's excellent, very good, good, or fair? And then I'm going to ask you to, again, if you have a pen and paper in front of you, you can definitely, write this down. If not, you can just think about whether or not you meet criteria for each of the categories. So this is what they call Mediterranean diet score. And essentially, if you meet the points for that criteria, you just put yes and you get a point. If you didn't, then you get a 0. So this is what the score looks like. It's the from Old Ways, and you can find it online also. And then when you look at it up close, you want to know, do you meet criteria for each one of these? Each one would be 1 point. If you got all of them, it would be 9 points. And if you didn't, you put a 0 next to each one. So are you getting 2 or more cups of vegetables a day? Are you getting 2 or more pieces of fruit a day? Whole grains, wine. Again, wine is a little controversial. Maybe a small amount in your diet might be useful and beneficial from a heart disease standpoint, but certainly not in large amounts. And fish as well, if you're getting it weekly, beans, legumes, nuts, and seeds, fat being from olive oil as opposed to things like butter or margarine, and limited amounts of red or processed meat. So you would actually want to have 0 servings, 1 serving, or 2 at most a week. So it's 2 or fewer a week. So you can add up the points and thinking about whether or not you meet each of these different criteria. And if you scored from 8 to 9, that's excellent. If you scored from 6 to 7, that's very good. 4 to 5 is fair, and 0 to 3, maybe you need a little bit of work in a few of these areas. So, when you think about the different types of diets that we talked about before, in my mind, these are all one type of diet. And the way I view it is what you would call a predominantly plant-based diet. And that's really the most important for health. Your diet has to include vegetables, fruits, legumes, whole grains, nuts. These are things that every single study that we've done have shown to see benefit. And smaller amounts, again, depending on which one you choose, of other components. And each of these diets have about 70% of their diet, the diet is identical. All of them reduce diabetes, high blood pressure, high cholesterol, and even mortality. So the way we counsel patients in terms of diet is we say, it's kind of like a spectrum. And the more of the good things that you eat in your diet, the better, and the less of the bad foods. And again, it doesn't have to be all or none. Even literally, if you went from processed meats to lean meats, you would make a major change in your outcomes and your health. Even if you got rid of like 1 can of soda a day, or eliminated, butter and started to have olive oil instead. So any small changes can make a difference. And I can tell you that, if I think back to myself in high school, even though I came from a Mediterranean background and a family that cooked healthy Greek food at home, I thought anything low fat was actually good for you. I thought that, a plain bagel or plain pasta or frozen yogurt, because they were low in fat, were actually healthy. This was actually a huge craze in the past in this country, and unfortunately what happens is people eat processed carbohydrates, which is really not any better than eating some of these bad foods. So hopefully, even early in your lives, earlier than me perhaps, you're going to have figured this all out to keep you healthy in the long term. So these are what I would say the supplements that I recommend in terms of improving your health. If you have a bunch of these in your diet early on, you could probably avoid medications. Then physical activity is very, very important. Getting at least 30 minutes a day. If you're trying to lose weight, maybe 60 minutes a day would be reasonable. And you can track, on your app. If you have an iPhone, this is actually the app that tracks your steps. And if you're not doing it already, you can just open it up. It's been tracking them for you. You may not know it. And getting at least 10,000 steps a day is really, really important. You can use MyFitnessPal. You can use devices to Fitbit to track your steps as well. But really, especially during this time, I would say that, gyms are closed and, sports are not occurring. You have to be creative about where you're going to get your exercise and think about it in advance, whether you're going to go bike riding, go for a walk, go for a jog, anything you can do, and even classes online. There's tons of stuff online for you to do in terms of group exercise classes, or you can just dance around your apartment, whatever you want to do, your home. So really, those are all really important. And the other one, especially as you move forward in your lives, stress will always be there. I'm sorry to break it to you, but intermittently for the rest of your life, you're going to have some small amount of stress that comes around periodically. And if you can figure out how to manage that and how to stay healthy, then you'll do so much better in your life. So some of the ways that we recommend to control stress are just sort of making a to-do list and prioritizing, figuring out ways to protect your own time. Having a positive attitude is actually tied into better health. So if you're the type of person who says, oh, no, this is terrible, and that's really not going to help you in the long term. In starting your day in a healthy way, turn on your music, go for a walk, do some exercise, relax whenever you can, get enough sleep, and enjoy time with your family and friends. This is something that we have, in our computer system. It's called dot phrases. So you just type the word dot something and all of this wording comes up, and this is how we explain to our patients, it is possible to do this. You can pack healthy snacks with you. You can choose when you're you're getting food for takeout, you can actually pick the healthier options there. If you're busy during the week, at the very least, you can get exercise on both days in the weekend. You can take the stairs or walk to work or walk to school. And then when you're traveling and you're on vacation, always bring your sneakers so that you can at least be able to do exercise on the go. Now, the last thing I'm going to tell you about is something called resiliency. And it's interesting that these types of things actually tie into somebody's health. And when they think about people who succeed in life, it's not always, whether you went to big Ivy League school or, what your income level was or to begin with or things like that. The people who actually succeed in life, it seems, are the ones who are able to cope with stress and adversity. It's like the people who get knocked down and get back up and are ready to go. So there's all kinds of resilience. There's physical resilience where, it's about your strength and, overcoming challenges physically. There's mental resilience when you're able to, change your mental flexibility, your optimism, how you view things in the world. Emotional resilience in terms of your ability to express and your emotions and to actually work on your emotions, and even spiritual resilience, and whether that's an actual religion versus just your spirituality is an important component of resilience. And all of these things are really important as you move forward, and going to school and in your careers. And, my biggest advice is that, you're at a point, now in your training, you're in high school, figuring out what you're doing next, and you're going to have lots of stuff coming up, in the future, that, the most important thing in all of these is definitely staying heart healthy, taking care of yourself. But as you make your decisions, whether they're in your personal life or in your career life or any of that, you probably know what you believe, and when things come up, you sort of say, yeah, I don't really know about that. That, I'm a little bit sketchy on that. That doesn't feel right. If you trust your gut on all these different things, you probably will not go wrong. So that's all I have for you guys, but I'm definitely open to questions from any of you on any of this stuff. And thank you for your attention.
I'm going to open the chat up now for questions. They come in pretty quickly usually, but you can just see the ones you can get to.
Sure. Is it under the Q&A?
You just hit the chat button at the bottom.
Yeah, I'm not, oh, maybe I have to escape my,
Yeah, stop screen sharing.
talk. That's why, got it. Oh my goodness, they come in quickly. Yeah. All right.
Got a lot of people here interested, so.
Excellent. These are good questions. I love it. Okay, so so Michael Greger is super smart. If you download an app called nutritionfacts.org, he has these little talks that are like 5-10 minutes each, and they're on a little topic, and he's just like super energetic, very funny, explains how backwards we have a lot of topics in diet, and he is very much in favor of a plant-based diet. So his book, How Not to Die, that's a pretty brilliant title, but literally that's exactly what nutrition is about. If we were to have started with nutrition, in this country and throughout the world and addressed all those issues, a lot of disease would not even exist. Literally cancer, heart disease, so many of them are tied to our diet. So yes, and a predominantly plant-based diet, as I mentioned, is the mainstay, and Michael Greger is great. So yes, that's a great book and a good point. Somebody asked about what we suggest for patients who are allergic to nuts and legumes when they should be in their diet. So Absolutely. What I'm talking about today is like a general idea for what most people should be eating, but there will always be individual issues. And even if it's not an allergy, like, maybe, certain foods upset your stomach or you get heartburn or whatever it is. So everybody, it's going to be a little individualized, but certainly if you are allergic to nuts and legumes, you just need other places that you can get fiber and good fats in your diet. And there's more than enough other places if it's whole grains or vegetables. Not one component, if you're missing it, is going to be a game changer, because there's going to be a ton of other things that you can do. Someone asked about the role physicians play in this work, and then RDs versus RDNs. Wow, these are really smart questions. Geez. So one of my main goals as a doc, when I started out as a practicing clinician, I was shocked that we didn't really provide information to patients. We didn't really get them connected to dietitians. All we did in a lot of places is just to give meds, which is crazy. So registered dietitians and nutritionists are key to this process. I always talk to my patients about diet, but I can't spend a full hour on diet because I never see any other patients for heart disease. So I absolutely think those are key people. And I would urge all of you to think about seeing one. I did actually years ago, and that was at a time when I was putting things like Coffee Mate in my coffee, which is not good. It's actually filled with trans fats and hydrogenated oils and things like that. So, not good for you. I was hungry all the time. I wasn't eating foods that were high in good fats and various things. So each of you, and usually as part of your insurance plan, many of them actually cover even a well nutrition or NetWell dietitian visit, and they actually will do even telehealth for many of these. So really having somebody go through and analyze exactly what you're eating during the day. You'd be surprised when it comes to even sports, if you're trying to perform better in sports and even mental acuity and various things, your diet is key. So I think those are a huge part of this. Staying at home during quarantine or our orders, how does this affect the cardiovascular disease burden? Brilliant question also. Essentially what we've seen is, sadly, a number of people have been scared to go to the hospital when they needed help, when they had chest pain, when they had symptoms of a stroke. So it's actually, in that aspect, has negatively affected people who actually did worse because they just stayed home with symptoms that were bad. But otherwise, yes, it's true that when you're quarantined at home, it's challenging to get in, some of the things that we recommend in terms of activity. What I have seen is that some of my patients actually did better at home because they were finally cooking for themselves. They weren't getting fast food. They weren't eating terribly. Some of them had more time finally to actually get out and exercise, or do things in their home, or even go for walks with masks and things like that. So it really can be variable. I personally love to work out and love to go to the gym or to do various things that it was limiting for me not to be able to do those things. So I had to get creative as to taking stairs, doing online classes and things like that. But you can definitely do all of this, and there definitely is research looking at the effects of these various things. Exactly true. And then in terms of stress and its effects, and whether it causes more plaque to deposit, or does it stress induce people to eat more unhealthy foods? It's individual. Some people under stress, very certainly not me, but some people say that they were so stressed they couldn't eat. Never happened to me in my lifetime. But anyway, for a lot of people, yes, they make unhealthy food choices during times when, in fact, they are stressed. So that can contribute. But yes, even the emotional stress can do things like increase your heart rate, increase your blood pressure. It can make your heart, pound, things like that, that can potentially have negative effects. So yes, stress has variable effects in different areas. So the best thing we can do is learn how to react to the stress. The stress, again, it's going to come. You guys are going to have a time when, you've got a boss that's difficult. You've got a class that you didn't do so great on a test, and you've got a friend who's, challenging to, deal with. So you're just how you react, and say, look, this is going to happen. I need to move on. I got to think of the positive. How am I going to handle this? That's actually what's going to keep you healthy in the long term. Somebody said to limit red meat as part of a healthy lifestyle in the heart. Is widely known that women suffer from iron deficiency, and typically red meat is recommended for those who are into. So that is a good point. You know, my mom actually would always say that, you know, oh, I made you guys liver because I know you need more iron and whatnot. And the reality is that there are so many vegetable-based foods that have a lot of iron, spinach and broccoli and various greens and different foods and beans that have iron. So there is no requirement for you to have meat, red meat, in order to get iron. You can get it there, but certainly not a requirement. And if anything, I think that if you switch over to vegetables that have a lot of these other components, especially as a young menstruating woman, then you would probably do even better health-wise in the long term. How do I meet people halfway who are reluctant to change their lifestyle? Yeah, that's the most important thing. I think that, you know, everyone has to understand that, you know, these are the things that can improve their health, but it's not an all or none. And, you know, the example I use is that I would say I do the 80-20 rule of 80% healthy and maybe 20% unhealthy. So periodically I eat ice cream, periodically I have some chips, but for the most part I'm eating healthy. So, you know, I'm not saying that everybody has to eat salad and water, you know, day in and day out, and there's nothing in between. But if you understand that even if you added 2 vegetables to your diet that you were not eating before, and you do that for the rest of your life, that will actually improve your health. So that's how I try to meet people halfway. The other thing is, I think that, you know, people need resources. They need good information that's accurate. They need programs that are going to help them to get to their goals, whether it's for weight loss. There's, you know, definitely programs out there. At our hospital, actually at Lenox Hill Hospital, in our office, we have programs that include dietitians and exercise physiologists and people who can actually help you to get there. But I think even just signing up for people to do exercise regularly, sign up for a run, maybe in a few months when we're back to having runs, that will get you motivated for a class, an exercise class, a sport, anything like that will also help you in your path. Somebody asked about soy and whether or not it's okay, especially for women. You know, it turns out that it's really the populations that eat soy, in Asian countries especially, do not have a higher risk of breast cancer. That's the concern that some people have when they say not to have soy. But the truth is that natural soy in things like edamame is actually not known to increase your risk. And it actually is a very good source of plant-based protein. So I do not necessarily tell my patients to limit soy. Can weightlifting subsidize for running? You know, there's all kinds of high intensity interval training type stuff that potentially could substitute running. You know, so running is more cardiovascular and it gets your heart rate up, makes you sweat. It has different effects on the arteries that is really beneficial. You know, if you did a series or a circuit of, you know, different exercises that was for resistance training and manage to get your heart rate up and you know, do things, you could potentially get some cardiovascular fitness or benefit. I usually recommend just doing some kind of cardiovascular activity. So whether it's bike riding or walking fast or running or something like that, but in combination, I think weightlifting and resistance training is actually really, really important for building muscle, for, you know, your health overall. So somebody asked how I began my journey in medicine. So, you know, oddly enough, I come from a family who there were no docs. My dad owned a bar and a bowling alley in the South Bronx across the street from Yankee Stadium. So I grew up helping out there and definitely not encouraged to go into medicine at any point. But one of my aunts worked in a nursing home as a nurse, so I volunteered. And I got an idea of what it was really like to take care of people and to be in a hospital setting and how interesting medicine really was. So I think that this type of a program, the whole idea is for you to get a sense of what a career in this area could be like. even if there's nobody around you who is doing this. And even if, truthfully, I was even maybe discouraged from doing medicine, and I was told, it's too much work, you really shouldn't be doing that, so I think that, getting an idea of what things are like, and then if you like something, you should follow through and pursue it. It's really, really important. Do I feel that medical school adequately trains doctors on nutrition? This is actually one of my major platforms that I hold a conference because of that, because we did a survey when I was at NYU previously and found that, most people feel underprepared. We don't get very much training in medical school or in our internships and residencies. As a matter of fact, one of the protocols for medical students, the only thing that was being taught a couple of years ago at one of the institutions is they would literally play the movie Forks Over Knives, which if you haven't seen is actually a very good film. I think you'll really like it. But that is literally their entire nutrition education. So this is something that we're certainly working on. I think the medical community is aware of how much of this needs to be targeted. So somebody writes about unhealthy lifestyle habits and diet are established by industries that push for higher consumption of certain foods, such as dairy industry, which has had its hands in school lunch programs for decades. What can we do to address the larger root socio-political cause in addition to educating people? This is a great, great question. As a matter of fact, I'm on the American College of Cardiology Nutrition Committee, and we both, work on smaller programs, but also on the legislative and changing policy areas also. So one of my colleagues, Neil Barnard, has actually managed to change what's being served in schools. So for example, many kids of Asian background, particularly of various cultures actually, are lactose intolerant. And yet, milk is really the main thing that's served in schools, which obviously is not appropriate. So they've managed to change the policy and to say that, they really need to standardly be providing non-dairy options for people. And yes, absolutely. I think that sadly in our country, a lot of this is driven by industry. There was an article that came out supporting how meat is healthy, and the scientific advisory group came out and published something which was absurd. And then when you look at the funding that a lot of these places have, and you realize that they're being funded by industries that unfortunately are selling these unhealthy foods. So we are very well aware that a lot of this, and the one important thing to keep in mind is I never realized this until probably recently, that essentially we can change this. Like, each one of you, there's 1,700 people on this call, I'm told. So every one of you can actually make a difference, and you see which area you think you don't agree in and you think is important. We managed to get in New York State, there's a bill that's been passed to serve at least one plant-based meal in hospitals, in all hospitals. And this came from us writing multiple letters to Congress and saying this is important for us to move forward. These things are things that we can actually impact and change, and as opposed to just complaining about them. That's another lesson I learned in my career, that apparently just complaining about things doesn't really help. So you think about a proactive solution and you work with people to actually get it done. Do I see racial disparity in heart illness? Absolutely. And what do I believe is the cause? Wow, that's a complicated question, but a great one. So, as you may have heard already, COVID is definitely a disease that brought out a lot of the inequities and disparities in our health care system. And unfortunately, depending on where you live, social distancing is maybe not as easy. Your access to healthcare, it may not be as good, or to advanced treatments or therapies that may actually allow you to stay healthy in the long term. Also, it's been noted that in certain socioeconomic groups, there are more poorly controlled risk factors, right? So more obesity, more high blood pressure, high cholesterol, things that actually lead to worse outcomes, even with COVID. So absolutely, in heart disease, I think that these things exist. And I think that our options to change that are really to change the resources that we have for different groups, making neighborhoods have more healthy food options, changing what's provided, having more walkable environments in certain places where this is actually sadly a place that either there are no sidewalks in some places, it's not safe to walk outside, there aren't options for kids to join programs or stay off the streets or do different things. So I think that, that's really where we have to target things, and just really making healthcare affordable and appropriate for all different communities. Somebody asks, how did I get interested in this specialty? Essentially, to be honest, I thought I was going to do interventional cardiology, which is to some extent the opposite of what I'm doing now. It's, fixing the arteries and procedures. And, I started off loving to put in central lines and take care of people when they were coming into the hospital sort of crashing, when they were really, really sick. But to be honest, I realized that I just didn't care enough about which balloon or which wire we used to fix, the artery. I cared more about talking to people and finding out about their story and how we could, really make a difference. So, this ties into everything. I love sports. I love, healthy eating and different things. This actually ties in really well. And there are actually a lot of advanced disease aspects that I still take care of with people who have advanced lipid disorders, cholesterol issues, and heart disease that runs in the family. So in terms of what genetic markers we're looking at when we say somebody has high genetic risk, that's a great question. So the most important thing is, in your family, you should absolutely know what kinds of diseases your parents, your uncles, aunts, your siblings had, and at what age. So if there's a significant, family history of things like cancer at an early age, you need to know that, because most likely that's because there's a gene that's going around in the family, and that's, putting people at risk. Same thing with heart disease. If you have a lot of family members who have heart disease, especially at a young age, if it's in a man before 55 and a woman before 65, then probably in your family you may have inherited a risk to have heart disease early. It doesn't mean you're destined to have heart disease. That's not actually the case. But that is actually how you would suspect. Now, the types of genetic disorders that we see very commonly in people who come in early with heart disease, one is called familial hypercholesterolemia, FH. And essentially it's when a family member, early family member, is having heart disease, but also high cholesterol. So that's the most common one we see. There are also a number of others that are like lesser degree. Somebody asked about the keto diet, and I have to speak on this because it makes me a little crazy to hear about it. A keto diet is essentially very, very low carb diet, and essentially it's very high in fat. There are some people who are looking into ways to do this in a healthy fashion by eating things like avocados, nuts, salmon, green vegetables. And, if there is a way to do it in that fashion, in a healthy way, potentially I would say that's not unreasonable. A keto diet is intended to put your body into ketosis, where it's sort of burning off its own fat, but the thing is that it is a drastic measure, and most of the time when people do it, they're eating predominantly animal products. And what I've seen people doing, and another important thing to get out there to people who are trying to like weight lift and build muscle and be lean, and thinking that if they eat a ton of animal based proteins that they're going to do well, like 5 eggs and 3 lean chickens and burgers for dinner and whatever because they're building muscle. One, will probably be meeting at some time in the future when you come in with heart disease, sadly. And 2, it turns out that there's a lot of evidence that plant-based proteins are really, really good for building muscle and, staying lean, and even for performance, like speed in terms of running. The world's strongest man, if you've seen a recent documentary, happens to be plant-based. So it's really a sort of a misunderstood concept that you need to eat, tons of eggs in order to build muscle. That's a really, really important message. And what else is there? Some of these questions are same as before. What is my favorite part about being a cardiologist? I think probably the 2 things I like the most is, one is the connection with patients and the ability to actually impact their life. When patients say, oh my God, I feel so much better. I'm doing great. I finally can take care of my kids. I'm not having symptoms or whatever it is. Or, they've made a change in their lifestyle that is really impacted their life, and then maybe even impacted other people in their family. That's really rewarding. And the other part is teaching, actually. When you work in an academic medical center, you have the opportunity to always work with students and trainees, and that environment of always being able to teach and learn at the same time is really exciting. It keeps it interesting at all times. It's very rewarding to be able to teach and to mentor. When I see some of my former trainees who are now succeeding and doing well, that can be really, really rewarding. All right, women's health. Somebody says, thank you for speaking on women's cardiovascular health. Not enough people talk about it. Absolutely. There's this misunderstood concept that, women don't really get heart disease, which is not true. We will get it later in life very often. But the reality is that, women's symptoms are also often discounted and thought not to be secondary to heart disease. Oh, it's just anxiety, don't worry about it. And that chest pain is probably heartburn and whatnot. But the reality is that we are just as susceptible, and really people need to be more aware of it. Exactly. Somebody asks about something, this is a really intelligent question here, about Takotsubo cardiomyopathy. And they want to know if you'll be at higher risk for developing heart disease cardiac events later in life. So Takotsubo cardiomyopathy is essentially what we would call a stress-induced heart attack. So any kind of significant emotional stressor leading somebody to have a heart attack. So, and people do recover very well from that often. It's usually less damaging in the long term than a typical heart attack. It's just different than the actual process of heart attacks where it's secondary to plaque buildup in the arteries. So a person who had Takotsubo's cardiomyopathy may be more susceptible to have that again in the future. But with respect to the typical heart disease, I would say it's still dependent on a lot of the usual factors that we know about, like we talked about, your sugar levels, your blood pressure, your cholesterol, your family history, your lifestyle. All those things are probably the most likely to be related. Somebody asks about vitamins and supplements. So one of the slides I showed, it said, these are the supplements I recommend, and that was filled with vegetables and fruits. So the truth is that I prefer that people get whatever vitamins and nutrients they're trying to get in their diet, to get it from food. That's the healthiest way to get it. Most of the studies that have done with supplements, unfortunately, don't show benefit in the long term in terms of improving your health. So it's really something that you should try to get in your diet instead, especially at a young age. I would say if you're in high school and you have the need to take vitamins and things just because you can't get in your diet, this is going to be a long-term problem. You should certainly speak to a nutritionist, dietitian, your physician, and see where you can get healthy nutrients. And do I consider the fact that heart disease symptoms such as heart attacks in women can present differently. Do I consider this an issue in medical education? Absolutely. We had a forum that was done previously when I was at NYU, and we do things here for the trainees that are sessions dedicated specifically to that. Even the fact that when you think about research, literally, 20, 30 years ago, the research was done only in men. Interestingly, they didn't even enroll women in studies. It was a little complicated for them because they were like, well, they could get pregnant and then we have to get them out of the trial and, things like that. So they just eliminated them. And then the assumption was that, whatever works for men, it probably works for women. Not exactly. So absolutely, we need more research in women. We need to get the word out about recognizing heart disease in women. And this is definitely a part of the core curriculum that we have in different areas. No question about it. All right. What else? The plant paradox. I think, oh, sorry, go right ahead.
I just want to say, it's getting to 12 o'clock.
Yeah.
If you want to maybe have any last question you want to answer, or any last words you want to say for everyone here.
Perfect. So yeah, so you guys are quite young, you're early in your life, but I think, a lot of the decisions that you're going to make moving forward, some of them are just on a individual level within your groups of friends, within your school, but you have the ability to do a lot, on a global level. You all have, every question here was quite intelligent. So I know you guys have the capacity to do quite a bit. So, if you have any questions, interest in cardiology in this field, I'm happy to hear more from you guys, and best of luck.
Thank you so much for speaking. And just a reminder for everyone, we have another lecture tonight at 4 p.m. on the Lenox Hill Instagram page. You have Tumor Talk with Dr. D'Amico. So thank you everybody for coming. Thank you, Dr. Gianos, for speaking today. Have a great day.
Thank you, Joshua.